திருநெல்வேலி மாவட்டம் பனகுடியிலேருந்து வரேன். சின்ன வயசுலேருந்து வீட்டு சூழ்நிலைனால பண்ணாமல் வீட்டில் பயந்து அப்படி விட்டுட்டாங்க. இப்போ நானாக ரிஸ்க் எடுத்து யூடியூப் சேனல் பார்த்து சார் பேசுகிறத பார்த்து நானாக ரிஸ்க் எடுத்து வந்திருக்கேன்.
Here with us a young boy. Well, he's not very young, but still, the reason why he's never had a surgery to get this lip fixed so far is because his mom was very scared, didn't have a dad, and then he also has some elder sisters, and they were also very scared for surgery. He lives in a small village, and so people around also, he was the only guy, only man, and they wanted him to be fine.
சின்ன வயசுலனா வீட்டில் கஷ்டம். அக்கா எல்லாம் 4 பொட்டை பிள்ளைகள் 40 பசங்க. அதனால் அப்படியே சின்ன வயசுலேருந்து கண்டியில் நினைப்பேன்.
So yeah, it's been, I think, several years, and I don't know how many hundreds of people have told him to get it fixed, and then he was always fearful his family were, and then today they decided to come here. So we're going to be operating on him. Now it's a complete lip. As you can see, he doesn't have any palate. Palate is perfect. So he never has any issues with chewing, eating, or speaking. So the muscles are all, you can so clearly visualize, it's bunched up here, it's bunched up here. It's never so visible in a primary baby, but it's more visible in adult because these muscles are bunched up. So I'm just going to have to dissect these muscles that are bunched up on this side and take it across to that side. This tooth, because there was no muscle, has come outside, and we're going to knock it off, and these have come down, and all of that will be taken care of a few weeks later post-surgery.
இப்போம்னா நமக்கு மெச்சூரிட்டி வந்துட்டு 24-25 வயசாகியாச்சு. அதனால தான் நானாக அது மெச்சூரிட்டி எடுத்து வந்திருக்கேன்.
All right. So do watch us. It's going to be a pretty straightforward, simple surgery for me, probably a few minutes, and then we're planning to also let him go home today so that he feels comfortable, and then he comes back after 4 or 5 days or 6 days to get the stitches removed, to clean the gum in case we use anything for the skin.
We have this patient with us. He came to our OPD with a complaint of a cleft in his lip. His age is 21 years, 24 years, and he has never been to a hospital regarding the same problem. They had a fear in his family that something big might happen if you go to hospital, so they never visited.
He's already 20 years old. It's been not operated. It's very rare to see an adult cleft lip nowadays. He also has a deviated nasal septum, so we'll be correcting the septum, minimal work on the nose, and we'll be correcting this defect. It's going to be a modified Miller's type of lip repair.
Sir, headache ho raha? Okay. Pani, juice?
Juice apple.
Which juice?
Apple madala juice anni
fresh juice. Okay. Fresh juice, water 2 to 3 liters in a day. Okay. Because of less water. Drink more water, headache will go. So today is his first post-operative day. As you can see, the patient is fine. The family is also satisfied. We'll see after we do the suture removal how the results have come. As of now, the sutures are intact, the dressing is intact, and we'll change his dressing mostly on the 3rd post-operative day.
போகலாம் போயிட்டு இவங்களுக்கு இன்னைக்கு என்ன டே?
Wednesday.
நம்ம பண்ணது மண்டே, டியூஸ்டே, வெனஸ்டே, சாட்டர்டே வர சொல்லு.